acute and chronic liver disorders. We will start with acute liver disorders, and we're going to talk about acute viral hepatitis. And there are theoretically 5 types of viral hepatitis, but practically they are only 4 types. So we have hepatitis A, B, C, D, and E. Hepatitis D, or this virus, is believed to be kind of variation of hepatitis B. So hepatitis D is kind of a mystery. For the sake of discussion, we will just focus on hepatitis A, B, C, and hepatitis E. There are many similarities between hepatitis A and hepatitis E. And the similarity is the route of transmission. It is fecal oral. Both are fecal oral, A and E. Whereas hepatitis B and C, they are parenteral via blood, so they are bloodborne. In addition to bloodborne, hepatitis B is also transmitted by sexual contact. And hepatitis B is transmitted from an infected mother to her baby during the perinatal period. Okay? Which one has more tendency to result in cancer? The answer is hepatitis B. Which one has more tendency to result in liver cirrhosis? The answer is hepatitis C. What's the most common cause of liver transplantation? Chronic hepatitis C. By the way, it's very, very, very rare to have acute hepatitis C. Usually hepatitis C occurs as chronic from the very beginning. This is the incubation period for all of them, and the clinical manifestations for all of them one and the same. So it's almost impossible to tell them apart just by the clinical picture. When you have viral hepatitis, regardless which type is it, all patients will have jaundice, dark urine, fatigue, anorexia, nausea, vomiting, weight loss, and with chronicity, there will be impaired liver function and eventually leading to cirrhosis. So we need to do serologic tests to differentiate between these types. Vaccinations for hepatitis. We only have vaccines for both hepatitis A and hepatitis B. Unfortunately, we don't have vaccines for hepatitis C, and we don't have post-exposure prophylaxis for hepatitis C. Okay, now we'll shift to chronic liver disease, and the end result of chronic liver disease is cirrhosis. So this list of 9 chronic liver diseases can be considered 9 causes of cirrhosis, because cirrhosis results from chronic liver disease. Cirrhosis is the end result of chronic liver disease. And if you notice, these 9 conditions can be categorized into 3 categories. Each category has 3 conditions. The most common cause of cirrhosis in the United States, which means the most common chronic liver disease in the US, is alcoholic cirrhosis. Alcoholic cirrhosis. And actually, alcoholic liver disease passes in 3 stages. Alcoholic liver disease passes in 3 stages. The first stage, the first step by which alcohol damages the liver, once alcohol starts to cause liver cell injury, liver cells will accumulate fat inside. And we call this condition alcoholic fatty liver. And this is diagnosed by ultrasound, and the liver will have a special look in the ultrasound. The fatty liver will have a special look in the ultrasound. It looks kind of shiny. That's alcoholic fatty liver. Alcoholic fatty liver, which is accumulation of fat in liver cells, is reversible, which means you stop drinking and the liver cells will get back to normal. If you keep drinking, this fat that accumulates in the liver is going to irritate the liver cells, causing inflammation. And because this inflammation is induced by alcohol, so we call the second phase alcoholic fatty hepatitis, because it's caused by accumulation of fat in the liver. A fancy term for fatty is steato. So the second stage of alcoholic liver disease is alcoholic steatohepatitis. What's steatohepatitis? It's a $10 word for fatty hepatitis. When patients have diarrhea with a lot of fat in stools, we call it steatodiarrhea. Steatodiarrhea is fatty diarrhea. Steatohepatitis is fatty hepatitis. Alcoholic steatohepatitis is inflammation of the liver cells as they get irritated by the too much fat accumulating in them. Alcoholic steatohepatitis is the precursor of alcoholic cirrhosis. So your chance to prevent the progression of alcoholic liver disease is the first stage. Your chance is here. As long as you just have alcoholic fatty liver with no inflammation, with no steatohepatitis, you stop drinking and everything reverts back to normal. But when you are in the alcoholic steatohepatitis, it has more tendency to become alcoholic cirrhosis than to return back to normal or just alcoholic fatty liver. So alcoholic steatohepatitis is the precursor of cirrhosis. That's the most common cause of cirrhosis. Alcoholic cirrhosis is a diagnosis of exclusion. You exclude all other causes of chronic liver disease, and you find a lot of vodka bottles in the patient's history, a lot of drinking in the patient's history, and this is how we suspect alcoholic liver disease. Let me jump to this non-alcoholic steatohepatitis, or NASH, because sometimes in obese patients, we can see this steatohepatitis with no history of alcohol intake. So if there is steatohepatitis with alcohol intake, that's alcoholic liver disease. If there is steatohepatitis detected by liver biopsy without history of alcohol intake, we call this NASH, or non-alcoholic steatohepatitis, which is seen more frequently in obese patients. Chronic viral hepatitis, most commonly seen with hepatitis C and hepatitis B, is another common cause of chronic liver disease and liver cirrhosis in areas of the world where hepatitis C and B are endemic. Okay, moving on to the three next examples of chronic liver disease, and these are autoimmune conditions. So we have autoimmune hepatitis. This condition will be characterized by the presence of anti-smooth muscle antibodies. You can detect in plasma antibodies that cause this hepatitis, and that's why it is considered autoimmune. Primary biliary cirrhosis. This is another autoimmune condition that usually affects females. Like most of the autoimmune diseases are more common in females than males. So primary biliary cirrhosis affects females, and these females will have itching because bile salts are irritant to the skin, jaundice with intrahepatic biliary obstruction, and positive anti-mitochondrial antibody, or positive AMA. The third autoimmune chronic liver disease is primary sclerosing cholangitis. And in this condition, we have both intra and extrahepatic biliary obstruction. And this complicates inflammatory bowel disease. It complicates ulcerative colitis much more than Crohn's, but it can complicate Crohn's disease if Crohn's disease involves the colon. The last category of chronic liver disease are the genetic metabolic disorders. Wilson's disease is a genetic copper metabolism disorder, and abnormal amounts of copper accumulate in the liver, leading to chronic hepatitis and eventually causing liver cirrhosis. And also some copper accumulates in the brain, causing some CNS manifestations. And copper, when it accumulates in the eyes, it results in Kaiser-Fleischer rings, kind of greenish nodules, greenish-brown nodules. Hemochromatosis is an iron metabolic disorder. Again, we have an error in iron metabolism. There is a lot of iron accumulating in the body because the receptors in the intestines that absorb iron as we take it with diet, they get satisfied pretty rapidly. They get saturated. And when they are saturated, they cannot absorb more than the daily requirement of iron. But in hemochromatosis, these receptors never get saturated. They never get satisfied. So you absorb a lot of iron. And this iron, for some reason, is not utilized in making red blood cells. So it starts accumulating everywhere. So when it accumulates in the liver, it causes cirrhosis, chronic liver disease that leads to cirrhosis. When it accumulates in the pancreas, it damages the pancreas and eventually leads to diabetes. And when it accumulates in the subcutaneous tissue, it causes bronze color, hence the name bronze diabetes. It can accumulate in the heart, causing some arrhythmias. That's hemochromatosis. It can, in males, it can also accumulate in the testicles. The last one of the genetic metabolic disorders causing chronic liver disease is alpha-1 antitrypsin deficiency. So what is alpha-1 antitrypsin? Is it good or bad? It must be good because its deficiency is one of the chronic liver diseases, and its deficiency can cause liver cirrhosis. So alpha-1 antitrypsin is the good guy protecting us against the bad guy, trypsin. So why is trypsin a bad guy? Because it's a proteolytic enzyme. It destroys the proteins in two major organs, the liver and the lungs. And actually, if we have, so this alpha-1 antitrypsin protects us against the harmful effect of trypsin. But some people are born with deficiency in this alpha-1 antitrypsin. So trypsin in these people is free to do damage to the proteins in the lung and the proteins in the liver. When you do damage and destroy the lung proteins, you will develop COPD at a young age. Usually COPD develops in patients older than 45 years. But if you have patients with COPD younger than 45, this raises the suspicion of alpha-1 antitrypsin. And then the liver becomes also damaged and you get chronic liver disease and eventually liver cirrhosis. So I'm going to end this segment here, and in the remaining segment, we're going to talk more about liver cirrhosis and the mechanisms and the manifestations.